Coming to the causes of Hallux valgus, it is 8 times more common in females as compared to males. And when we are talking about adults female, the most common cause is what you can see in the picture. It is actually wearing shoes with a narrow toe box. Now, your forefoot would always be like in this position, this would result in problems of the first stay, leading to all the issues and eventually resulting in Hallux valgus. Now, there are different causes. It's not isolatedly in females and related to shoe wear. Shoe wear is just one of the cause. The most other common other causes which lead to Hallux valgus includes, first of all, is shoe wear with narrow toe box and high heels. That is why it is almost 8 times more common in females as compared to males. The next cause is age related. It has been seen that usually it's over the period of time there is development of osteoarthritis at the metatarsophalangeal joint, which actually predisposes and exposes the first metatarsal head, and this has been seen with the advancing age. Usually females or males, they both tend to develop Hallux valgus. Then is the genetic predisposition. That is why initially it was thought that it's probably the biomechanics, the disturbance of biomechanics has a role in development of Hallux valgus, especially when the evidence was emerging related to the females wearing high heels and narrow toe box shoes. But with the further research, there are adolescent form and juvenile form which actually started to appear. This means there is definite genetic predisposition as well. And even in adults, those almost 70% of the adults have a family history. Now, with the family history means they are more genetically predisposed to this condition, and if it happens to be a female who happens to wear high heels and narrow toe box, that means that she's more likely to get Hallux valgus as compared to another female who is not genetically more susceptible as compared to this female. Therefore, genetics has a lot of a role, especially in the case of adolescent and juvenile form, even in some cases the adult forms as well. Then comes the pregnancy. As with the pregnancy, there are actually multiple ligaments gets relaxed, and usually the first metatarsal head is more hypermobile during this state. This results in actually the pulling of adductor hallucis and leading to lateral deviation of the phalanges, and the metatarsal head goes into varus. And this is sort of a complication which usually settles down, or it may not progress after pregnancy, but it usually can be related with the pregnancy as well due to ligamentous laxity which has been developed during this state of pregnancy. Then rheumatoid arthritis has also been implicated as one of the causes of development of Hallux valgus. Why? Because the problem starts with the metatarsophalangeal joint. There's pararticular osteopenia, and then the parosteal cyst formation as well. This leads to actually the disturbance of kinematics at the first metatarsophalangeal joint and metatarsal head, eventually leading to formation of Hallux valgus. Pes planus, as this is means pes means foot, planus means flat. Flat foot is one of the condition because it depresses the first ray, and flat foot has been related to one of the risk factors as well as the cause which is actually leading to Hallux valgus. Why? Because there is actually the flattening of the first ray which is actually seen in the Hallux valgus, and this has been seen to be contributing to the Hallux valgus formation. Then some other causes include cerebral palsy. Why? Because the intrinsic neuronal injury which occurs at the time of the birth, this results in increased spasticity of gastrosoleus muscle and actually the tightening of the muscles of the foot, especially the intrinsic muscle of the foot. And this has been seen in the certain CP child. They have predisposition towards development of Hallux valgus very early on in the life, for example in adolescent or early adulthood. Then is the ligamentous laxity. Ligamentous laxity disorders such as Marfan, Ehlers-Danlos syndrome. There has been association of these because the joints are hypermobile. There is always a tendency to sublux and actually resulting in Hallux valgus formation. All of these are causes of the Hallux valgus. But one thing one has to be clear, and these are all contributing causes. exact cause what causes hallux valgus is still unknown, and it's termed as a disease of multifactorial etiology with an unknown cause. This is exact cause is not known, but all these things have been implicated in its etiology and risk factors, that the all high heels, female gender, genetics, age, pregnancy, pes planus, ligamentous laxity, cerebral palsy, and rheumatoid arthritis all have implicated into formation of hallux valgus and disturbance of biomechanics at the first ray of the foot. But what exactly leads to this problem is still relatively unknown.